All right, everybody, welcome back for another Facebook Live tour. Today we are at our Emotional Wellness Center. I'm behind cameras again. You can't see me, but we're at our new Emotional Wellness Center. And today we have the lovely.
Dr. Alicia Henderson. I'm the Senior Director of Mental Health Services here at Ryan Health.
Awesome. Welcome. Welcome. Dr. Henderson, how long have you been at Ryan Health?
About 3 months.
3 months.
A very short time, but it feels like I've been here for a long time. I'm loving it.
Awesome. Take us around. Where are we now?
Well, first, I want to say to you all, welcome to Ryan Health's new Emotional Wellness Center. As you can see, this is a very nice, safe space here at Ryan Health's Emotional Wellness Center. Um, it's a welcoming space, it's a self space, it's a confidential space.
Great. Hello.
This is one of our patient service representatives. As you can see, she is here to welcome all of our guests.
Nice.
Here, this is our intake. This is our intake office. This is where our intake coordinator will also be welcoming new clients that come into the center looking for emotional wellness.
Great.
And here we are. This is where the magic happens. So join me around here. I'd like to introduce you to one of our mental health coordinators. Excuse me, she's our clinical supervisor.
Hello.
Hi. Hi. So, introduce yourself to the audience.
Sure. My name is Nicole Morona. I'm a licensed clinical social worker, and I provide clinical supervision to the staff here. Additionally, I provide therapy to our community.
Okay, tell me about the therapy services that are offered here.
Sure. So we provide individual therapy and group therapy to the community. In individual therapy, we typically work with people who are struggling with things like anxiety, depression, life transitions. And most recently, we've been helping a lot of people who are struggling, in the aftermath of the COVID-19 pandemic, providing support on that.
Okay. I don't think a lot of people know, but we never we never closed down our emotional wellness center. I know we have a new space, but all through the pandemic, you all were working remote, I think.
Yes, yeah, and we continue to offer services via telehealth. So, in addition to coming in person, people still have the option, to see their therapist and psychiatrist remotely.
Amazing. And just to be clear, is this free?
Uh,
So, yeah, I was just going to say we do work with insurances. A majority of our clientele are covered through insurance, but Ryan Health does offer a sliding scale option, which is really beneficial to a lot of our members.
Okay. Thank you. It was so nice meeting you.
You too. Thank you.
One last question. How do you like the space?
It's beautiful.
It's
And we
beautiful.
hope you all like it too.
Awesome. Thank you. It was so nice meeting you.
Thank you.
Wonderful. So you've just met Nicole Morona, our clinical supervisor. We also have a registered nurse on site. Let me just wave.
Hello. Now, why would you have a registered nurse on site?
We want to ensure that all of our guests have physicals, up-to-date physicals. As you know, physical health and mental health are so very closely related. And so she's right here on site to make sure physicals are done, vitals are done. She keeps track of all of our vitals and any other medical needs that might come up while one of our guests is here with us.
Perfect. Can you explain to everybody what is that noise? It sounds like
So yes, that noise can be a bit distracting, but it actually serves a great purpose. We are here in this beautiful office space, but we want to ensure confidentiality. And so these are called sound machines. And so these sound machines really do mask voices and conversations that are happening in each room.
okay. We're all about privacy, and I like that.
So in addition to mental health services, in addition to psychotherapy, we also have psychiatry. So if anyone needs the support of medication, we do have we have 2 psychiatrists on site, as well as a psychiatric nurse who's also on site to help manage those needs.
Wow.
And here down this corridor, these are all of our wonderful therapy rooms.
How many new exam rooms are here?
There are 7. One of our therapists.
Hi.
There are 7 therapy rooms here. And we also have some group rooms, but I'll show you those in a minute. We don't need to see down there, do we?
No, unless you want to show everyone your pantry. Sometimes the therapist needs a break.
Yes. So this is where the therapist and this is where we come sometime to get our emotional wellness.
Of course.
In the middle of the day.
Of course.
This is our gathering spot. This is also where we come to have our lunch and our coffee. Again, this is our emotional wellness space.
We need a therapist to take care of
That's
themselves.
right, that's right. And so I mentioned our groups in addition to individual psychotherapy, family therapy, group therapy. This is our group therapy. So this is one of our group therapy rooms.
Amazing.
And as you can see, it's still somewhat in its infant stage. We have a couple of monitors that are coming that are going to be on the wall to help out with some of our group sessions.
This room is so big, but also very private.
Absolutely. So you will notice the frosted glass here. This room, I don't know if it's noticeable on Facebook Live, but this room is right in the middle of our space here. As I said, this is where the magic happens. So this room is right in the middle of our space, and so we have this frosted glass here for confidentiality.
So again, what happens in a space like this?
And so we have different groups that go on. We currently have a teen group. It's called Real Talk. That has become very successful over the past 2 or 3 weeks. We'll have some parent groups coming up, and we've gotten really creative. We have lots of different groups that are going to be coming up very soon. But so far we have the teen group and the parent group. Here's another one of our group spaces.
Very big, very spacious.
Currently, the staff, we come in here and we participate in some of our group meetings in here when we're all on site. So we'll come in here so that we can all be together. We have the screen here where we can participate in our meetings.
Great. For the groups, do you have to be a registered patient? How would one find out about a group?
And so our groups are listed online, but also if anyone has a primary care physician through Ryan, there are flyers throughout our different centers. So a lot of the primary care physicians are aware of our groups because some folk who are not a part of our emotional wellness center can also participate in the group. So you don't have to be in therapy here.
Thank you.
So that's what makes it so special. We're open to everyone.
Again, so to be clear, you do not have to be a Ryan Health patient to receive services group, but also what about emotional wellness center? How do you have to be a Ryan Health patient to participate,
No,
or
you do not. So we accept self referrals. And so oftentimes people will call seeking services here at Ryan Health Emotional Wellness Center. Again, we offer individual, group, couples, family, collateral sessions here on site at the Emotional Wellness Center.
okay? Well, let's see if there's any questions in the chat. We're gonna see if there's any questions that come in. While we wait, I have a question.
Okay.
What do you love most about the new Emotional Wellness Center?
Well, I love that it's very bright and cheery. I've only been here for about 3 months, but I have worked as a psychotherapist and in leadership in mental health for a very long time. And I have never been in a space that feels this bright and welcoming while also being a very safe space.
Amazing. And I love that you're right on the street.
Yes.
Look at all these people walking
by. Lots of light coming in.
And if you're walking by, you can just pop your head in and just see what's going on in here.
Absolutely. But you can't see right through. You can see right through there, but if you're waiting in our waiting area, that glass is also frosted so that you also have confidentiality once you walk through these doors. Okay.
Sounds good. I don't think we have any. Oh, wait, let's see. Okay, we have one question.
Okay.
If I'm not sure why I'm not feeling good, how do you all help me to figure out? How do you help me to figure it out in therapy?
So what happens first when you come here seeking services is that you have an intake. And so with the intake, there's a series of questions that we're asking you. And those questions help us help you figure out if there's something that you need to work on with someone who's trained to help you figure it out. So you might not know exactly, you just might know that you're not feeling yourself. And so you can come in and meet with someone and they can help you figure out what it is that you need. You're very much a part of what your treatment looks like.
Okay. And what are the hours for the center?
On Mondays and Thursdays, we are 11 to 7. And Tuesday, Wednesday, and Friday, we are 9 to 5.
Thank you. Let's see if there's any more questions. Well, I can see the comments. Okay. Are there plans to expand more group therapies?
Absolutely. We are creating and developing more group therapies as we speak.
Love it. I mean, these questions are coming in very slow, but they're coming in.
Yeah, I see. That's wonderful.
Yeah. Any last thoughts about the center? Any like one takeaway that you want everyone to stay with, or to stay with everyone? What would that be?
I would just like to say to everyone, we realize that with the pandemic, people experience things that they had never experienced before. One being social isolation in a way that we've never had to experience before. And so if you're feeling in any way that you're not yourself or you're not interested in some of the activities that you used to be really excited about, or you're having some relationship issues that you weren't having prior to the pandemic, whatever it is, if you're just not feeling yourself, please come over and see us here. We're at 801 Amsterdam Avenue, the Emotional Wellness Center, and you can walk right through the door and seek services, and we welcome you.
Dr. Henderson, that's amazing. We'll just take 1 minute to see if there's any more questions coming in.
No problem.
Okay. Oh, wait. All right. That's it.
All right.
Thank you so much.
Thank you.
Stay tuned, everybody. We'll have more Facebook Lives. Again, I'm behind the scenes. You can't really see me. But stay tuned. We'll have more Facebook Lives. Thank you so much, Dr. Henderson. We really appreciate it.
Thank you for visiting. Bye.